Good evening, everyone, and welcome to April's edition of the Ask Mary and Pat Show featuring Miss Mary Finner and Miss Pat Boga. Thanks for tuning in from wherever you may be, either you're on our Facebook Live or on the app. And today, this is the first time that we are live streaming on our personal Healthy Kids YouTube page. So please share that if you are able to. We will have a few questions that have already come up to us. So Miss Mary Finner, Miss Pat Bogle, and her guests will be able to share. We also have a special special segment with Brother Clarence Campbell, who will give vital information. Well, before we get started, I want to go over a few reminders for the month of May. The next third Wednesday Parent Resource Chat will be May 15th at 11 a.m., and that will be centered around stroke. The next Ask Mary and Pat show will be in June. We will not have an Ask Mary and Pat show in May because of Memorial Day, which is the last Monday in May. So, without prolonging any time, I'm going to turn it over to Miss Mary Finner.
Good evening, everyone. My name is Mary Fenner, and I am a Medicaid Application Administrator for Oak Hill Regional Community Development Corporation. And this evening on our Ask Mary and Pat show, Pat is not with us tonight, but we do have Mrs. Doretha Knox, who's going to help and who has questions. It's going to be on with us. We also have Mr. Clarence Campbell that's going to be on that he's going to give us important information that we need to know. So now we're going to get started with questions that we have already received. I'm sorry, Ms. Knox, you can come on and introduce yourself.
Oh, all right. I'm Doretha Knox, and I'm a Medicaid assistant, and I'm here to assist you in any way possible. And do you want me to go on and do my questions,
Yes.
Ms. Center? And
Yes.
the first question that we have from a consumer is, I'm applying for Medicaid for my entire family, but her family consists of a 7-year-old, 19-year-old, and herself. What she wants to know, can all of us be in the budget, in the Medicaid budget? And the answer is you, and she does with no income. You, the 7-year-old, and the 15-year-old will be counted in the budget. The 19-year-old that's turning 20 will be ineligible. We will have to apply for ACA for him, but to apply for ACA, we need some kind of income. So the question is, go on and let's submit your application, but the 19-year-old will not be in the budget. All right, the next question is, I've been recently approved for Medicaid, and I received a letter, and I need to know, can you help me choose my MCOs? No, we cannot. We do not help you choose your MCO. What I would suggest to you, check with your provider. See what MCO your provider use. Then you choose that MCO for your family. Because if we pick one, it might be United Health. Then your provider don't take United Health. So it's not to our benefit to help you pick a MCO. It's for your benefit to be sure you call your medical provider and see what MCOs that they use. Then go from there and pick your MCO. Fill out the form that they send you, select your MCO, and sign it. Be sure that you always turn your papers back into the Medicaid office. All right, Ms. Finner.
Okay, then that was some good questions. Okay, another question that I have is, okay, if I move, do I need to contact the office with my updated information? You really need to contact the Medicaid office with your updated information so that they can stay in contact with you. And that's been an issue. People have
Yes.
moved and have failed to notify the office. Then when they send out a renewal notice, it comes back to them, and what they'll do is they'll cut you off automatically. They will not try to search you and see where you've moved to. Even if you have a forwarding address on file with the post office, they're still not going to send it to a forwarding address. You have to contact them and let them know that you have moved with your new information, including a new phone number. If you have a new phone number, you can even send them an email, because sometimes they will contact you through email, so you can send them an updated email address as well. Okay. So another question I have, what can I do if I'm no longer eligible for Medicaid? Well, as you may know, that there's been a lot of people taken off of Medicaid because they're no longer eligible for Medicaid. Once you turn 19, you're no longer eligible. If a parent was on, and once the child turned 18 and there's no one in the household under 18, well, the parent came off of Medicaid. So, and I know a lot of people are looking and searching for other type of medical services. Well, if there's household income, you can apply for health insurance through the Affordable Care Act. If there's no household income, then or it has to be a certain amount as far as income goes too. So therefore, you can go to one of our federally qualified health centers to get assistance. There is a fee, and the fee is on a sliding scale, so it's done according to your income. So you can always go to one of those. And if you need to find out where one is in your area, you can contact us and we can help you find one that's in your area.
Mhm.
Okay, some people want to know when they can tell if it's time to renew their Medicaid because they haven't received a renewal notice in the mail. Usually it's a year from the date that you receive Medicaid. So up to 3 months prior to the end of that Medicaid, you would get a notice in the mail, a renewal notice. Please open up your mail from Medicaid, sign your renewal notices. Most of the time, they may have already have information on you. You may not have to send any additional information. You can sign it and send it back to them. If they need something additional from you, then they will contact you. But once you get that notice out, then that means your date has started, that they have received it. So more than likely, you won't get terminated. Now, if they give you 2 weeks to get that information into them and they don't receive it within that 2 weeks, yes, you will get terminated if you don't turn in their required information. But if you have questions, please contact your Medicaid specialist and let them know that whatever is going on in your life, if you think it's time for your renewal notice and you haven't received one, contact the Medicaid office and let them know I have not received the renewal notice. What should I do? So also you can contact our office, and our number is 662-298-3584. And one of our Medicaid application administrators can help you with reapplying for Medicaid or applying for Medicaid for the first time. But if you're not sure when your renewal needs to be done, you really need to contact the Medicaid office. We may be able to find out the information from you, but it's for you, but it's not guaranteed. So you need to try to talk to your Medicaid specialist at the Medicaid office. Okay. And what number do I need to call to apply for Medicaid? Well, the number that you can need to contact will be the Medicaid office, and they will let you know what you need to do further. Or you can contact us at 662-298-3584. Contact us and we can help you with applying for or renewing your Medicaid online. There's an online application out there on Medicaid, MississippiMedicaid.gov. But you can give us a call and we can help you with renewing your application or applying for Medicaid for the first time. Somebody asked, do we charge for services? We do not. The service to you is free. If you, whatever service that you may need from us, as far as filling out Medicaid applications or just slipped my mind what I was about to say. Oh, applying for health insurance through the Affordable Care Act, or talking to one of we have a social worker that's affiliated with us that can help you as well with other type of medical needs you may have. She may be able to help you with prescription services. So if it's something that you need, you can contact us, and we do not charge any fee at all. And so now I did see Mr. Campbell on. Are you still on, Mr. Campbell? No, I don't see him any longer.
Miss Fenner.
Yes.
Miss Fenner.
Go ahead. Did you have a question?
I had one more question
Go
that
ahead.
I need to ask. You know, in the past, step parents' income used to be disregarded. It is no longer disregarded. If you have a step parent in the budget, you must submit his or her income because it is counted and it helps to determine eligibility. So it's no longer disregarded. It is counted. You put them on, income have to be submitted in the application.
And that is so true. That is a new policy that Medicaid has. At one time,
Yes, ma'am.
they did not count the step parents' income, but now they do. And it may cause your child not to be eligible for Medicaid, but that's what they do now. They do count the step parents' income. And we have a question in chat. Who can apply for Medicaid or CHIP for a child? Anyone that has custody of that child or anyone in that household can apply for Medicaid or CHIP for that child. The only income that's going to count is the parent's income or the step parent's income. That's the only income that counts for the child. Now, if you're a sibling and you're old enough and you're taking care of one of your younger siblings and you want to apply for Medicaid for that sibling, you can, and your income will not count for that sibling. Only if it's a parent or the step parent. Also, if you're a grandparent and you want to apply for Medicaid or CHIP for your grandchild, you can apply and your income would not count towards that child getting Medicaid or CHIP. Okay, then there's another question. What do Medicaid or CHIP covers? Medicaid or CHIP covers the 10 essential health benefits that any type of medical insurance will cover, such as doctor's visits. Also, it would cover emergency services, prescription services. If your child needs to go and have any type of services, such as dental or vision, it covers dental and vision for your child. It also covers if there's any type of mental services that need to be the mental health services, it covers that as well. Also, any other type of any medical services that's required that you may need Medicaid and CHIP works the same as any other type of health insurance. There's nothing different. You just have to make sure, as Ms. Knox was saying earlier, that your doctor takes that particular service that you have. If you decide to go with not Humana, um, I can't think of, but if you
United
decide
Health.
United Health or Magnolia, if you decide to go with either one of those, then you have to make sure that's what your doctor takes. Okay, so someone has a question. Someone's asked, does receiving Medicaid or CHIP benefits affect someone's immigration status? No, it does not. If you're not applying for Medicaid, if your child is a citizen, if your child was born in the United States, and the child automatically is eligible for Medicaid or CHIP and goes through the same type of income verification that any other person would. And the parent's immigration status will not will not be affected because you're applying for health insurance for your child. Okay. Now, and also there's also if you are not a citizen and you have some type of emergency that comes up, or if you're pregnant and you're not a citizen, Medicaid will pay for the birth of the child, and then the child will be automatically put on Medicaid. It will not pay for any type of services leading up to the birth. But once you go to the hospital and have the baby, Medicaid will pay for that hospital birth. And also, you'll be eligible for pregnancy Medicaid just for the birth, and also the child will be automatically added to Medicaid. Those are the only questions that I see. I was, Mr. Campbell, are you able to talk now?
Yes, I am able. I'm going to start the video. Excuse me. And what I'd like to talk about is I've noticed that recently I've gotten a number of, I'm going to call them ACA cold callers. ACA cold callers, I'm using this term to describe people that are calling my house, asking me questions and trying to get me to sign up for coverage through the Affordable Care Act, Obamacare, or something such as that. The people that are calling, they may identify themselves by name, but they're using burner phones. And okay, a burner phone is a phone that they call out on, but if you try to call back on that number, get a message that that number is not in service. This has happened for two people that called me, and I looked up the numbers, and I got an address and a name possibly for them. And then just for the fun of it, I thought I'd call the number back to inquire in terms of what they really have to offer. And in both cases, I got the message that that particular number was not in service, but yet that was the number that they had called me on. And so we as navigators need to be aware that this is going on out there. And also, if there's anybody on that's not a navigator, you also have to be aware of that there's a lot of scam artists that are out there trying to obtain person identifiable information from and do who knows whatever with it. Typically, if you get an ACA cold caller, one of these scam artists, first of all, they're not going to identify themselves as a marketplace navigator. They're not going to say, my name is so-and-so, and I work for, and the state of Michigan is only one navigator organization. So they're not going to say, I work for Oak Hill Regional Community Development Corporation as a marketplace navigator. Move into questions. And then the next thing, they're not going to use our standard procedure of asking permission to obtain and use personally identifiable information. They jump right into asking you these type of questions to try to get this information. And so that's just one thing that we need to be aware of. And then something else that's been going on for a while, try to share my screen and show you this information if I can find it. Oops. Okay, so for our consumers out there, and for our navigators that might be working with consumers that have done a little bit of research on your own, this is about making sure that you're on the correct health care insurance website. And by that, what we mean is the proper website for healthcare insurance is healthcare.gov. The full address is https://www.healthcare.gov. And when you enter this site, you're going to see for the second little section that I have circled, it says that it's an official website of the United States government. And then if you were to click on the link there where it says, here's how you know, then it would give you additional information about how you know that this is the official website. And so when you go onto this particular website, what it means is that you're going to be working with a marketplace navigator that's going to be certified. Any personally identifiable information that you get or give them is not going to be shared with anybody. And we're also not going to charge you for anything. There are the commercial brokers that are out there and the scam artists out there that will charge a fee to submit the application for you. Marketplace navigators do not charge a fee. We are compensated, but we're not compensated on the basis of how many people we enroll and what types of premiums are we able to stick them with. So this is the correct website. Again, healthcare.gov. Something that you might see from time to time if you're not careful. You might think healthcare.com. .com is a more popular extension for websites. Healthcare.com is a commercial website. It looks pretty much like healthcare.gov, except that this particular site is not going to connect you to a marketplace navigator. Now, the brokers, the agents that work on this site, they may very well sign you up for plans that will offer advanced premium tax credits to reduce your monthly premiums. But by and large, the plans that they're going to sign the consumers up for are going to be plans that are most beneficial to the agent in terms of the amount of compensation that it'll generate for the broker. Okay, another one that you might see, and let me see. This one is on Facebook a lot, healthinsurance.net. And if you have this particular ad pop up on your Facebook post, it'll look like it's an official site for healthcare.gov or for CMS, which is the basis of healthcare.gov, but it's not. It's just another commercial site. You may also see something that looks like this. This one just happened to go to Florida. Must have been based off of some other zip codes I had entered at one time, but you might get something that says looking for, and they'll say Mississippi Obamacare plans. Obamacare is it's the nickname for marketplace insurance or Affordable Care Act insurance. And a lot of people only know it as Obamacare. And so more than likely, if someone's promoting Obamacare to you and not marketplace coverage or ACA coverage, then they're probably a commercial broker or agent that's again looking to get you enrolled into a policy that's going to generate a nice healthy commission for them. So I'm going to go back to healthcare.gov and show you that this is the correct site to go into. If it doesn't look like this, if it doesn't say that show website, then you're in the wrong site and you need to get out of it as soon as possible. Okay, any questions about that? Okay, got a little bit additional information. Oops, that's not it. Okay, there were some questions about the 10 essential health benefits. Stefano was mentioning the 10 essential benefits that are covered with Medicaid plans, and marketplace health insurance plans also cover these 10 essential health benefits. And so I just put this up here to list them for you in writing so that you can see them. So they're ambulatory patient services, outpatient care you get without being admitted to a hospital, emergency services, like surgery and overnight stays, pregnancy, maternity, and newborn care, both before and after birth, mental health and substance use disorder services, including behavioral health treatment, and this includes counseling and psychotherapy, prescription drugs. There's rehabilitative and habilitated services and device services to help people with injuries, disabilities, or chronic conditions to gain or recover mental or physical skills, laboratory services, preventive and wellness services and chronic disease management, and pediatric services, including oral and vision care. But adult dental and vision coverage aren't essential health benefits. Now, one thing that's particularly beneficial about marketplace insurance is the preventive and wellness services. The preventive services that are available are pretty extensive, and these are services that will be covered without having to pay down your deductible. And so they run all the way through alcohol misuse screening, counseling, blood pressure, cholesterol, colorectal cancer screening, depression screening, diabetes type 2 screening, diet counseling, fall prevention, hepatitis B and C screening, HIV screening, PrEP, which is pre-exposure prophylaxis, HIV prevention medication, and then immunization for adults. Chickenpox, diphtheria, flu shots, the hepatitis A and B, measles, meningococcal, mumps, whooping cough, pneumococcal, rubella, shingles, and tetanus. And then it continues on into lung cancer screening, obesity screening and counseling, STI prevention and counseling, statin prevention medication, statin for cholesterol levels, more STI screening, tobacco use screening, and tuberculosis screening. These preventive services are part of the 10 essential health benefits that are covered with the Affordable Care Act marketplace plans. All plans cover these. And these particular items I just mentioned, again, you have these available to you before you pay down your deductible, and usually there's going to be little or no cost for them. Okay, and that's about all that I have, unless there's some questions.
Okay. If there are no other questions, we're going to turn it over to Duke. Are you still there?
Yes, ma'am, I'm here. Give me
Okay,
one
that's all we have for tonight.
All right, give me 1 second to go through just to see if we are good on social media. And it looks like we're good on social media. uh, Once again, thanks everybody for joining. Ms. Finner and Ms. Knox, thanks for doing such an amazing job, and as well as Brother Campbell for doing such an amazing job of providing good quality information. You may learn more about us at oakhillregionalcdc.com and www.healthykidsms.org. You can contact our office at 662-298-3584 or text us at 662-689-9712. Once again, we acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. This has been a production of Oak Hill Regional CDC, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Have a great evening, everyone. We hope to see you on next time.